Patients being wheeled into emergency, suddenly desaturating to stabilize them. Some of them even with the best efforts we couldn't save. It's difficult to see that. Patients come with a globe rupture. And in cases like this, when we are supposed to remove the eye, the UV light, the blue light causes an alertness in our body. So now if you use a screen at say 12 at night and then you want to sleep at 12:30, that's not possible. Botox is basically the short for botulinum toxin. It is a toxin.
Do you have a work-life balance?
So you can't just switch your mind off and say, it's my personal space, I'm not going to think of it. It doesn't happen that way. The aim is to either reduce the dependency or completely eliminate the dependency on glasses. So if your cornea is not thick enough or your eye health is not good, then no, you cannot undergo this procedure.
Hey guys, Kevin here on behalf of the Wellness Workshop. I'd like to welcome you to the Wellness Pod, the official Wellness Workshop podcast and a place where my guests and I chat about all things of wellness. We like to keep it simple but interesting. Myths, truths, fun facts, experiences. Who knows where the conversation goes? That's for us to know and for you to find out. My guest today is Tanvi Goanker, one of Goa's youngest and most successful female ophthalmologists. As a professional ophthalmologist, she's gained recognition for her reputed work in LASIK and associated surgical procedures surrounding the eyes and eye care. She's also obtained fellowships in the International Council of Ophthalmology in the UK and the All India Collegiate of Ophthalmology, New Delhi, in oculoplasty, where she was crowned a gold medalist. That's not all. Tanvi comes with a host of education credit, including 6 years at JNEC Delhi, in various subspecialties like cataract, glaucoma, pediatric ophthalmology, strabismus, ocular trauma, ocular oncology, and facial aesthetics. We live in an internet generation where a lot of people now wear spectacles and contacts due to long exposure to blue light and screens. So let's uncover the truths behind eye care and how it can aid you. Who knows? Maybe you have better clarity on what you and me have lagged for so long. This is going to be pretty cool. At least I think so. Over the episode.
I wouldn't call myself a visionary, but I feel from this pod, we're going to get a lot of insight. Welcome to the Wellness Pod, Tanvi.
Thank you, Kevin.
It's a pleasure having you here. Would you like to introduce yourself very briefly to our guests?
Yes. So I am Dr. Tanvi Goanker. I did my undergraduation from Goa Medical College, and then I did my post-graduation in ophthalmology from Maulana Azad Medical College in New Delhi. And I also continued in the same college. I did my senior residency there in a specialized branch of oculoplasty, ocular oncology and facial aesthetics. And now I'm back to Goa to serve the people of Goa.
This might seem a bit contradictory, but at a very young age, you've been doing this for a long time. So when did you start having a passion for eye care or eye surgical care in general, like this industry? Were you always passionate about it, or was it something that you were like coaxed into as a kid? Considering that your parents also do this.
No, I was not coaxed into it, definitely. Okay. So strangely, as a child, I actually wanted to become an astronaut. So yeah, but that's a very superficial dream.
Didn't we all?
I was impressed when I used to study geography with the planets and all, and I was like, I wanted to be an astronaut.
Right.
But that was very early. But then eventually I was brought up in a family of ophthalmologists. Both my parents are eye doctors. So our daily discussions, at the dinner table would be about eye-related cases and new patients and the surgeries done. So somewhere I got drawn to that branch, Maybe these family influences had some sort of a role in my formative years. And then I landed up taking ophthalmology.
You said your parents play a big role in where you are right now because they are also ophthalmologists.
Yes.
And they've built the hospital which you'll consult your patients at. But how did you personally build what you have today, which is a reputation that we've come to know very recently about you, and being one of the state's youngest ophthalmologists? How did you build what you have today?
See, a major part of that goes to the skill that I have acquired in my college in Delhi. So actually after I finished my undergraduation, I actually was fortunate enough to get the institute of my choice, which was Maulana Azad in Delhi. And it's amazing that the number of patients you see, the number of surgeries you perform in such a short amount of time, it makes you a very confident surgeon. So what I am today, even though it required me to step out of my comfort zone and leave my home and go to a new city, I think it's all worth it. So what I am today, the ophthalmologist that I am, is all because of the institute and my teachers and my seniors there, and of course my parents. So So when I came, I already had the support of my parents. It's difficult to start as a youngster, but yes, when you have the support of someone above you who are experienced, then it's a little easy, right? So,
This college that you've mentioned, the one in Delhi,
Maulana Azad Medical
is it
College.
is it for my I mean for the audience that's watching, is it difficult for an ophthalmologist to get into this college?
So what happens is currently the exam system is such that before you choose a college of your post graduation, you have to answer an exam called NEET PG. So how you fare in that one exam decides what rank you get, and accordingly decides what college you're going to get.
Makes sense.
So yeah, so even if you have a list of colleges you want, it depends on how you have fared in that exam. Yes. So it is one of the institutes which goes up at higher ranks. So yeah.
In the medical industry, ophthalmologist is quite a selective line. So you've acquired a lot of certifications and educational metrics, I would say. How detailed can it get in terms of studying? Because when I was going through the list of things that you've actually done and achieved, the list went on and on. So where's the full stop in terms of education in this line?
Let's just say a medico never stops studying, okay? As simple as that. You can never get up and say that I have studied everything and I know everything, I've read each and every book. It just doesn't happen. So at one point you may stop giving exams and acquiring qualifications, but the learning never really stops, because I think every patient that walks into your OPD is going to teach you something new. So yeah.
And I think as a generalized thought that runs across every industry, I mean, even being a wellness coach, there's something new that's coming up every single day. Either it's a contradiction of something that we believed in the past, or it's something that they found, because there's such a large data bank that we now have, and of course budgets have increased to perform more research studies, so we're getting a lot of evidence-based research studies on different things that we either thought were one way and now they are the other, or we're just finding out new stuff about our bodies, and the list goes on and on. So I think it's very good to constantly have that repeated learning in any industry.
Yeah, and you have so many conferences that you attend, so many meetings, updates. So you're keeping abreast with the latest technology, and it's important. Because even like any other field, medicine is also having a lot of technological advancements. So yes.
I think being a student all your life is one of the biggest inspirations you can self-motivate yourself to be, because there's so much to learn.
Yeah, and it's not forced learning. It becomes your passion at the end of it. You do it.
Absolutely.
Yeah.
Absolutely.
You enjoy what you do.
I think education is revenue and wealth that we don't consider monetary, but it's still a very tangible
It actually makes you
reciprocity.
rich. It really makes you rich.
Absolutely.
Yeah.
In this line, what were some of your biggest struggles?
Okay. So one thing is to leave the comfort of your home. You know, you are leaving your home, leaving Goa. It's fun, it's food, and going to a new city. That is definitely difficult. Okay. Secondly, I stepped into a new city with new people. So it took me a while to get used to. And then after that, of course, the work hours. As a young resident, you're putting in a lot of work hours to ensure that you're competent and you are up to the mark. And then to come back in that tired state of mind and then having to study is also difficult, especially when you don't have family around with you.
Right.
Yeah. So I think all of this was definitely a struggle, but when I look back now, it was definitely worth the struggle. And of course, the turmoil caused by COVID, that was universal for everyone.
How did you manage during that period? I think that was a difficult period for everyone in medical.
Yeah, it was very difficult. We had a lot of duties to do, and we had to take care of patients, and it was difficult to see patients that way, you know.
Right.
Patients being wheeled into emergency, suddenly desaturating, to stabilize them. Some of them, even with the best efforts, we couldn't save. It's difficult to see that, you know. And since COVID was something new, there were treatments being introduced, but again, they were all new things for us, not something that it's already established. Yeah, so we tried our best to save all the people that we could. And yeah, so it was definitely difficult. And of course, I was away from family. And knowing that people here are also suffering, and I was not here at home. So it was difficult then.
I think in general, the life of a doctor is very hard. Long work hours, and I don't think there's ever been a doctor that I've spoken to that has said that it's been an easy way, because just putting aside the amount of education that you need to even reach a reputable level in your industry, it's very difficult to have a work-life balance and manage your professional personal life. So Do you have a work-life balance, or how do you create one given the duties that you have?
See, to be very honest, there's really no clear-cut demarcation, between a personal and a professional life. Okay, like medicine becomes a part of your life. Okay, so you might think that okay, I will not think of this at home, but imagine you've seen a new patient in the morning and you go back home in the evening and you still find yourself thinking about that patient. So you can't just switch your mind off and say it's my personal space, I'm not going to think of it. It doesn't happen that way. Yeah. And another thing is your friends, your colleagues also happen to be in the same line or usually in the same line.
Right.
So your personal life
I
really
see.
doesn't suffer because then you toil together and then you're having fun also together. So yeah.
Nice. And I assume that in that work-life balance, you also get time to spend time with family. Also,
Yes, of course.
do you ever get the chance to go on holidays?
Yeah. So that's one of my passion is actually exploring new places and traveling.
Really?
So whenever I get the time off, I plan a time off and I go out exploring places. So that's something which is very close to my heart and I wish to keep doing it all my
Nice.
life. Yes. And it gives you the energy to come back to work with a clear mind.
Absolutely. I think that's a very underrated benefit of traveling,
Yes.
for sure.
Yeah.
Which reminds me, I was very curious about some of the names that I saw in your, I would say, short resume.
Okay.
The procedures that you've done, I swear I had like a lisp multiple times while pronouncing those things. Like I felt like I was going through like a different, like my tongue didn't agree with what I was saying. It was hard to pronounce. So can you take me through some of those names and what they actually mean?
Okay, fine. So I'll start with the most basic. Okay. The most commonly performed surgery worldwide is cataract surgery. Okay.
Right.
So what is cataract? It's basically a graying of the natural lens in the eye.
Okay.
So initially cataract surgery was done with the removal of the cataract and placement of a lens by different techniques. The latest one is phacoemulsification, which is a machine which is used.
Phacoemulsification.
Yes.
Wow.
Yeah, you
Okay.
basically emulsify the lens and phaco is lens. Phaco lens. So we remove the lens by that machine and a artificial intraocular lens is placed inside the same area to replace that lens. So before cataract surgery was all about just clearing of the cataract and giving
What's
the
an
patient some vision.
intraocular lens?
Intraocular is inside the eye. Intraocular.
Okay,
Ocular
that
is
makes
eye.
sense.
Yes.
Got it.
So it's an artificial lens which is placed in place of the lens that you have removed.
Got it.
So initially it was all about clearing the cataract and giving them some vision. Initially it was first introduced.
Noted.
But now it is actually, the advancements are such that the cataract surgery is more of a refractive surgery where the aim is to either reduce the dependency or completely eliminate the dependency on glasses.
Amazing.
So much so. Now coming to glasses, the second set of surgeries is refractive surgeries, okay, which includes surgeries like LASIK and ICL. That is another way when patients do not want to wear glasses.
What's the second one?
ICL. ICL is implantable Collamer lens. So if you are not a fit candidate for LASIK, okay, then the other option could be ICL. That's another option for it.
So what's the difference between both? Because I feel like a lot of the, not just the viewers, but generalized people, when they're doing LASIK, they don't know that there are types of LASIK because they say that, okay, you have to meet and I've spoken to a couple of people that said you need to meet a criteria before you get LASIK done.
Yes, definitely.
But they've never gone beyond the explanation of, okay, you need to meet the doctor and they'll certify you as to whether you can get LASIK done. So what are the requisites for them to do either or, whether it's LASIK or ICL?
See, the most important requisite is the age. You have to be above 18 to 21 years to undergo the procedure. Why? Because the number stabilizes by then. Your eye growth is complete. So you don't want to undergo a procedure and then have the number come back after that. So you cannot, yeah. So of course, so because of that 18 to 21 years is the cutoff. Only above that is when the procedure is done. Because if you have even at 21, if your number keeps changing, you're going to still wait. You're not going to go ahead with the procedure. So we normally ask the patient, when was the last time you changed your glass? When was the last time you changed your spectacle number? That's the first prerequisite. Secondly, now, what is the difference between LASIK and ICL? LASIK is a procedure where the anterior surface of the eye, the front surface of the eye, it's called the cornea. So what LASIK does is it permanently reshapes that cornea so that your effective eye number is 0.
Got it.
Okay, that's LASIK. But because what happens in LASIK is you're shaping the cornea. Your cornea has to be thick enough. By shaping we mean a part of the cornea is also removed.
Noted.
So if your cornea is not thick enough or your eye health is not good, your retina, which is the innermost layer of the eye, is not healthy, then no, you cannot undergo this procedure. Yeah, the cornea being thin, say, we ablate the cornea, we remove a part of the cornea. It's not going to be able to sustain for the rest of your life. So that is when you're not fit for LASIK.
Got it.
In such a case, then you go for the second procedure, which is ICL, which is implantable collamer lens. In this case, in front of your natural lens, you go and put in another lens, and that helps to focus the rays of light right bang on the retina. So
Interesting.
always the LASIK is preferable as the first option because it's an extraocular procedure. You're not going into the eye. So if not
But in
LASIK,
case you have bad eye health,
if
this
you're
becomes
yeah. So in
an
case
option.
you don't have a enough corneal thickness, then it's always better to go for an ICL because you're not suitable for LASIK then.
And what if you have maybe someone that is below the age of 21 but has glasses at a very young age and their power is very high to the point where they may need LASIK? Do you let them ride that wave till they are at the age where it's stable and then do the
Yeah,
procedure?
so you cannot do it before that. If the number is changing, you definitely cannot do the
Is
procedure.
it possible for someone to have a very high number even before 21?
Of course, it's possible. It's called pathological myopia. The number keeps progressing with time.
Is that something that is that like a, I don't know, okay, I don't know how to term this, but is it normal or are there certain conditions where people can be born with a bit of a defect?
Yeah, that's not a defect, but yeah, it is a condition where the number keeps changing and you can have problems related to this in the retina of the eye. So
Okay.
retina is a light sensitive layer inside the eye. So the light focuses on the retina and then that is transmitted to the brain to form an image.
Got it.
So a very high myope or myopia, the eyeball is big. Imagine a balloon. You put in more air, it's more at a stretch. So a big eyeball has the retina inside at a stretch. Something which is at a stretch can develop breaks inside.
Interesting.
Okay. That can eventually cause a retinal detachment. Doesn't lead always, but it can cause. So in these patients, a regular, thorough, annual or even biannual examination of the retina is recommended in very high myopes. So yes.
Do you also have cases where accidental damages caused to the eye have to be, like, you have to consider, like I know a lot of people that have gone through eye damage because of accidents, something hitting their eye or they've met with an accident where it's hurt the eye directly. How do you go about a procedure like that? What are your examination protocols to then determine the damage done to the eye and what the procedures
so,
recover?
Yeah, of course, there is a branch called emergency ophthalmology. So, you know, you have to deal with all that. Yeah, there are quite a few road traffic accidents and all which lead to severe injury to the eye. So, when the patient comes to you, you're checking what is the vision of the patient, what is the extent of damage.
Right.
Is it only the anterior part of the eye which is affected? Is it the inside of the eye which is affected? And it can vary from something as minor as a hemorrhage inside the eye, a subconjunctival hemorrhage, which is just an hemorrhage in the front of the eye,
Okay.
or it can go up to hemorrhage inside the eye. It can lead to a retinal detachment. There are so many other conditions. It can even lead to a full thickness laceration, something like you get a bruise, you get a cut on your hand,
Right.
if you have a knife hit. Similarly, there's a knife which hits your eye, you can get a cut there as well. So the severity varies. So depending on that, that's the treatment which is provided. So
Have you dealt with personal cases where someone loses their
yes, of course,
eye?
we've dealt a lot of it when I was in my residency days, a lot of it in emergency. So yes, it becomes a little difficult when it feels a little bad when you
what's
cannot
the worst
save.
case you've dealt with?
No, there are times when the patients come with a globe rupture. Globe rupture is when the eyeball is no longer in the same form as it was normally supposed to be. And in cases like this, when we are supposed to remove the eye, because it's not possible to keep the eye in that shape and form. So it is difficult. It's difficult for the patients, difficult for us to also do it for them.
Do they replace the eye or do they just?
It's replaced with an artificial eye. You cannot replace the entire eye. There
So
are
they just see with one.
They see with one. Like you can transplant the cornea, you can transplant the cornea is the front surface of the
Right.
eye. But you can't change the whole globe. That's not possible. Or at least it's not come as yet.
I mean, who knows? That might be the next advancement.
Definitely. Let's hope for it.
What are your thoughts on contact lenses? Being someone that's worn glasses, I've had my sweet and sour relationships with contact lenses where they've worked for me for a season, then they've not worked out because they're drying out my eyes really bad because I have a bit of a higher power. And I think the large majority of people also wear contacts because it gives them a bit of freedom in terms of wearing sunglasses or doing their everyday activities without bothering to keep pushing the glasses up. Your thoughts?
So contact lenses are definitely one of the ways you can treat refractive errors. Okay. So when it comes to lower errors, lower errors, spectacles and contact lenses, they fare equally well. You can choose whatever is comfortable for you. But when it comes to higher errors, the contact lenses are slightly better because the quality of vision is better. A thick glass is a little difficult to manage. So contact lenses are better. But contact lens has its own limitations. Okay, not everyone can get used to a contact lens. Like I personally, I have a very minor number, but I can't get used to it. I can't get used to the contact lens. That's number one. Number two, yeah, contact lens has certain restrictions. Like you have to be able to take care of it. You need to have a strict contact lens hygiene. So that's another thing. So the best compromise is if you're going out, you're in the office hours, you wear your contact lens and then you come home and switch to your pair of glasses. That's the best compromise and the best bet. Yeah.
But is there a certain, like I know a lot of people have a difficult time with lenses because of the dryness of the eyes and also the fact that you have to be so careful with touching them because it can also wear it out, and also the fact that it's, I don't know whether it's biodegradable, but I always had the bit of irk of putting something that's plasticky in my eye.
Yeah, so a contact lens is a foreign body after all. It is foreign to the eye.
Is there a danger to it?
Yeah, so there is a danger if you don't follow the instructions. Okay, so one thing, yes, it can predispose to dryness, but you can always have a lubrication drop with you, which you can put just the way you put lotion on your hands or you're putting moisturizer on your skin. Why can't you put a lubrication in your eye? It's not that difficult.
Would you recommend someone to use contacts over spectacles?
Oh, it's the patient's comfort.
Okay, so they're both on equal measure.
They are both equally. If it's comfortable for you, you can go ahead and do it. But yeah, you have to maintain the contact lens hygiene. By hygiene, I mean is there are daily disposable contacts.
Yeah.
There are contacts which can be used for 1 week, for a month, or even a year. But they have to be cleaned well. Your hands have to be cleaned. You cannot wear them when you're swimming. You cannot wear them when you go to sleep. And the hygiene has to be good. It has to, even the contact lens case has to be taken care of. The contact lens solution has to be used within the expiry date. So all of this has to be taken care of. When you can do it, then there's nothing like it. Yeah.
Convenience the inconvenience. Fair. Eye drops. You said about eye lubrication.
Yeah.
So I've used eye drops a lot, but I don't know. Do they really work? Are they good? Are they bad? Are they a scam? Do they help? Are there certain types of eye drops that are better than others?
Of course, eye drops help. Like of course. So if you see any allopathic eye drop manufacturing companies, they have this very rich research and development facility where they try to develop and manufacture new medications which are beneficial for the public.
Right.
And every drop goes through a lot of trials before it's actually introduced into the market. Okay, and those trials, if they fail, then they're not introduced. Then before introduction, they have to be FDA approved. And even after they're introduced into the market, they are continuously monitored to ensure that there are no untoward side effects. So definitely not a scam. Eye drops work. Of course they work.
I think from the time where I started wearing glasses to what it is now, a lot of people have started wearing glasses in general. I mean, of course, work from home has become a very large, I would say, component of why that is. But a lot of people are now exposed to blue light because they have their laptops in front of them while they're working, which is why we're of course seeing a surge in the total amount of people that are wearing glasses now. What are your thoughts on, is that a good habit to have? Is there something that we can do to sort of mitigate the damages from that? And address me like I'm a work from home person that spends 9 hours looking at my computer.
Okay. So yeah, it is a thing. It's a separate entity which is called as computer vision syndrome, what we call it. Okay.
Okay.
So yeah, blue light, yes, you do get a lot of blue light emitted from the screen. But to be very honest, it's negligible compared to the sun, which is the most potent source of the blue light.
Got it.
Okay. So yeah, it does cause digital eye strain, but the eye strain is more because you're focusing on a screen and the blink rate goes down. What do you mean by blink rate? Normally you're blinking about 12 to 15 times per minute. But when you're staring at a screen, you're not blinking that often, maybe 5 to 6 times per minute. And that causes some amount of dryness. Most people who work on screens for very long usually complain of dryness. By dryness they mean there's something poking inside the eye, or they feel a sudden blurring or transient blurring of vision.
Because blinking moisturizes the...
Yes, the blinking basically distributes the tears on the front surface of the eye.
Got it.
Yeah, that's the most common. Secondly, what happens with use of screen? it affects your sleep cycle, it affects your circadian rhythm. So why do we wake up when the sun rises? It's because the UV light, the blue light, causes an alertness in our body and we wake up. Okay. So now if you use a screen at say 12 at night and then you want to sleep at 12:30, that's not possible, because that is also releasing some amount of negligible blue light. It's causing you to be alert, and then most of these people also have disturbed sleep cycles.
Right.
There are complaints that we don't get sleep till late night. You know, most mothers will complain that my child doesn't sleep till late night and all. It's because you are seeing a screen and then you are expecting to sleep 10 minutes after that. That's not possible. It's just not possible.
Every health guru has painted this.
Yes. And it's absolutely
Reduce
true.
screen time and go to sleep early, but they've never given the reason scientifically as to why they need to do that, and you've nailed it.
Yeah, and that's why always avoid screen time, any screen time. By screen we also mean phones, not just laptop and iPad and computer. So it's better you avoid it 1 to 2 hours before you go to sleep. Recommended. And most people, they scroll through the phone and then they go to sleep. It doesn't happen.
A lot of people sleep with the blinds on, so they wake up with the natural body clock waking them up. Do you suggest that over having the blinds open and being exposed to the rays of the sun to wake up, or does it add any significant difference, or is it negligible?
Doesn't really make much of a difference, but yeah, what I do recommend is spend some time outdoors also. The current work scenario is such that most of us are inside the house or inside the office. But you need to have a significant amount of outdoor activities as well. You know, like before it was always about outdoors, like you go out, you work outside, anything. But you need to have some amount of sunlight exposure as well. But yes, having said that, too much of UV exposure is also not good. So which means you need to have a good pair of sunglasses as well when you go out and expose yourself to the sun so much. So any glass which blocks UVA and UVB both is usually recommended.
I had this doctor that once recommended that between 7 in the morning till 8 in the morning is mild sun, which is when you have to look at the sun and blink. Now, I don't know whether she was pulling my legs or whether that's actually effective, so could you shed some light on that? It was strict, like Tanvi 7 to 8 was 7 to 8. So I look at the sun and blink at it multiple times and it's going like decrease your eye number.
No, it said 7 to 8 is a good amount of sunlight. I don't know whether you have to blink at it, but yeah, you should go out at that time. That's all I can recommend.
No, she told me you have to look at the sun. Is there like a particular positive reinforcement that comes at looking at the sun at that time?
I am not aware of anything like this that you have to look at the sun, but yeah, you have to go out at that time. That will be a good thing for you.
I think that would be good as well. I just, the only thing my power didn't get lost, I just lost time, but well. What about red light therapy? That's something that's pretty big in the industry right now to look at I think they have a certain lumination number that you have a light that has a certain amount of there's a certain red light. You can't just put any red light, right? It has to have that luminosity, and you stare at it for a certain amount of time. It heals damaged tissue in your eye. Now, I don't know the extent to which that is on eyes. I know that they've claimed a lot of it for the skin and bones and muscles, but assuming that the eye is also part of the body, I'm assuming that there would be some translation that's positive. Could you shed some light on that?
See, red light therapy is what? You're basically exposing the body or the part to some low level wavelength of red light. So yes, you're right. It is actually introduced for skin conditions first, like acne or wrinkles, or it basically promotes collagen formation. So what this red light actually does is, it promotes healing. It decreases inflammation, which is also swelling, and it decreases pain. So in ophthalmology, it's relatively new. So it has been introduced for some retinal conditions like diabetic retinopathy. So diabetic changes inside the eye, or age-related macular degeneration, which is again an age-related change inside the eye.
Got it.
So research actually shows that these therapies have helped in slowing down the progression of these conditions. In fact, some people have even gained 1 or 2 lines of vision after this therapy. It has also been introduced for dry eyes, because red light apparently stimulates the glands inside the lid, and that helps in dry eye. Another area where it has shown some benefit is slowing the myopia progression in children, when the eye is still growing. In children, not once you've already attained the age of 21.
Right.
Yeah. But this is relatively new in ophthalmology. So we have the short term results. Long term effects we still don't know. So we'll have to wait and see.
Interesting. Growing up, I feel like we've always been told that if you wear your glasses for a certain amount of time, you will be able to get rid of them and your power will rectify and it'll get better. I don't know, that's not applied to a lot of people because I've selectively, I wouldn't say selective, okay, it's at a macro level. I've seen too many people go on the opposite, and such as myself, yours truly speaking to you, it gets worse over time. Like, it's not gotten better. It just, like, the glasses get thicker. And are we doing something wrong?
See, it's not accurate to say that if you wear your glasses, the number is going to go. That's not how it is. Now you have a number of say -5. You're a myope. You don't want to wear glasses. Okay, but if you wear glasses, it's not like your -5 is going to go down to 0. That's not possible. Like we already discussed, a myopic eye is a big eye.
Right.
And because it's big, you have a number of -5. So if you're going to wear glasses, how is the eyeball going to reduce to its normal size? That's not possible. So it doesn't happen that if you wear glasses, your number is going to come down. Or if you don't wear your glasses, the number is going to progress faster. There's no relation to that. But if you don't wear your glasses, you're not seeing clearly. So you're just troubling yourself. You're going to not see clearly, you're going to get headaches, there's probably going to be some blurring of vision, you're not going to be able to efficiently work. So why put yourself through all that trouble when you have options available?
Can you wear glasses for an extended period of time and get rid of them?
No.
Okay, so we've been lied to. Great. Wow. Thank you for the podcast. Okay. Interesting. What's the latest tech we're looking at in the industry? What has changed over the last? I think just before we started the pod, we actually had a conversation with Tanvi on how the tech has gone through a mass improvement over the last couple of decades. So, where were we 10 years ago and where are we now? Just from let's zoom out and look at the advancements in tech.
Okay. So, like any other field, there are a lot of technological advancements in ophthalmology as well. So, and ophthalmology has a lot of subspecialties, which means every part of the eye is dealt with a different specialty.
Got it.
So, each of them have their own advancements. So, to name a few, one of them is teleophthalmology, which is quite big now. So, what is teleophthalmology exactly now? It's a way of providing the high-tech eye care to people in rural areas, which don't get these facilities that easily. So, what they do normally is there are these either mobile vans or primary care clinics or vision centers in the rural areas, and they have these equipments to either capture the patient's eye number or the retinal photo, and then this is transmitted to the base center where the doctor is sitting and analyzing.
Interesting.
So what is the advantage? You are basically triaging the patients. Patients in the rural areas who actually require urgent specialist care can then be referred here. There are some people who don't require, they can be monitored, they can be asked to stay there and we can monitor them there as well.
Very interesting.
Yeah. Second thing in this itself is artificial intelligence, which has also entered everywhere else. Yeah. So the same images which are captured can also be analyzed by artificial intelligence, and they can actually tell us whether the patient requires immediate treatment or the patient can be monitored. That is second. Then there is also something called gene therapy. So gene therapy is what? There are some conditions inside the eye. You are born with a defective gene. You can't do anything about it. And then that can predispose you to some eye conditions. And because it's an inherited condition, there's not much you can do, not much an eye doctor can do. So there are these gene therapies, trials going on where you basically target that defective gene.
Got it.
So they either introduce a healthy copy of that gene or they silence that defective gene so that the progression of the disease can be slowed down. That's one of the other things which are quite new.
This is fairly recent, gene therapy?
Gene therapy is actually in trials. It's still in trials.
Oh, it's not?
Yeah, it has been started in some countries, but we still don't know the results yet. It is being tried. So yeah, these are some of the latest ones.
Telehealth is the more...
Yeah, and it is being done in quite a few institutes in India as well.
Interesting.
Yes, so it actually benefits the economically weaker strata who cannot really travel to all places, and
very important. I think that's a big breakthrough.
That is definitely a big breakthrough. Yeah, let's hope it comes up even more.
For sure. So you were telling me that at your time in Delhi, did you do a lot of LASIK surgeries there as well?
No, I didn't do LASIK surgeries there. So like I said, I was in oculoplasty, ocular oncology and aesthetics.
Right. So more of the LASIK surgeries, I mean the mass of them that you've done are here.
So I have not done, my specialty is not LASIK.
Okay,
My
so your
specialty
parents
is,
do it.
yes, my parents do it. My specialty is oculoplasty, cataract.
So with some of the surgeries that you've done, do you always, I mean, you've probably been doing it for a very long time now, but do you always fear that there is like a chance of error that can happen?
There's always a chance of error,
Okay.
but I think surgery is a work of passion. It's an
Beautiful.
art.
Absolutely.
And that fear of having an error or a fear of failure cannot really deter a passionate surgeon.
True.
So I think a good surgeon is not just one who gives a good outcome. You know, surgeons are trained to manage complications and yet give a good outcome. So I don't think a fear of error should not let you operate, because you're already
If there is an
prepared.
error during the surgery, is that like
Then you're prepared for it.
Is there a
That
countermeasure that you haven't faced?
Of course, you are
Amazing.
trained for that. That is why the training is so extensive and it's so exhaustive, because you are managing each and everything that can go wrong and still trying to give the patient the best outcome.
Amazing. Have you seen a situation where you had to perform a remedial measure when there was an error during?
Of course, it happens quite regularly that where we want to, if things don't go the way you have planned,
Right.
then you take the second path and you give them the best outcome.
I think that's pretty cool, considering that I think doctors don't get a lot of credit for the fact that there's also an error rate that can happen. For other industries, yes, you can make errors, but when it comes to someone's health, there's so much more precaution that has to be taken, and you guys make it look easy, so well done. So you said that you worked with patients that have done Botox and dermal filters. Can you enlighten us on how do you go about Botox and dermal filters?
Okay, so what is Botox? Okay, Botox is basically the short for botulinum toxin. It is a toxin. So what it does is, wherever it's injected, it temporarily paralyzes the muscle. Okay, so obviously it's used for conditions where the muscle is overworking. So most commonly Botox is used for two purposes, either functional or aesthetic. What do you mean by functional? There are people who come with muscle spasms. You have twitches on your eyelids or eyebrow twitching. That is something you take care of with Botox. Secondly is aesthetic purposes. You have a lot of wrinkles on your face. You have lines and creases next to your eyes, what we call crow feet commonly. Or you have some forehead lines. So Botox, when injected into these areas, either relieve the spasm or they take care of those lines. So what you need to remember is, it's a temporary effect. It temporarily paralyzes, which means the effect lasts for about 4 to 6 months, after which you will need a repeat injection. And second thing is, yeah, you need to get this done by a trained professional who is well versed with the anatomy. You know, it has to be injected in the right place.
Okay.
Yes, so that's about Botox. What about fillers? Fillers is basically something which is injected to give volume. So if you have something like a hollowness, with time, suppose with time you lose a lot of fat in your body. So especially in the face, especially under the eyes, you have fat loss and you feel there is a hollow underneath your eyes. Then you can give, one of the indications will be you give a filler inside that and give you a natural look to that. But again, to be done only by trained professionals.
And you're saying that every 4 to 6 months they have to have a repeat injection, but for how long? Is this continuing for the rest of their life?
Yeah, so normally the frequency of the injection may go down with time, but yes, usually every 4 to 6 months initially to begin with.
Do you think it's sustainable for most people, or is it for someone that just wants to do it
So
as a transient?
it has to be done for a patient who is motivated. A patient who comes to you saying that this is what we want.
Okay.
We want to get rid of these things. So it has to be highly motivated. You cannot do it for a patient who doesn't want it, because he is not going to continue the treatment. It's only for the patient who walks in and says, okay, you please take care of this for me, and then we can go on with it.
Do you have a lot of men do this as well, or is it just women?
No, there are men as well.
Okay.
Yes.
Interesting.
Yeah.
Where are you guys at? Where are you handsome boys with these jawlines at?
As long as you're happy with your looks, it doesn't matter.
Absolutely. I
Yeah.
think it's a great point to touch on.
Yeah.
We've always seen that Botox has been given such a bad rep all across the internet.
Is it?
Because we always feel that there are supermodels that are abusing it, and they have they look very different from what they used to when they do that. But I think it's mostly because they don't know where to draw the line, and probably because they don't have the doctor advising them the right way, because I think we're all lured a little bit by the cash cow that comes with taking those repeat injections. So
Definitely. Like I said, it has to be done by someone who's trained. And don't overdo it. Like anything,
Yeah.
don't overdo it. Because at the end of it, it's a toxin. Yeah.
True.
Yeah. So do it in limited amounts.
Okay, I've got an interesting one for you. I think you've worked with a patient like this, but I've recently come across a friend's father that had diabetes induced eye issues. So I don't know if you worked with someone like that, but could you touch on how someone has to manage their eye health when they have diabetes? And does diabetes cause issues with your eye, and what are the progressive stages on which it can worsen or get better?
So yes, I've worked with a lot of patients of diabetes related changes. Why? Because Goa is the diabetic capital of India, if you know.
It is.
So almost every other patient who walks in has some diabetes related change inside the eye. Okay. So what diabetes does is, in addition to causing a rise in blood sugar, it basically affects various organs inside the body. Okay. Almost all of them, but particularly the eyes, the kidneys and the nerves. So the beauty of the eye is that any changes that are happening can be directly seen, as opposed to organs inside where you can't see the changes. You have to rely on blood tests or urine tests for that. Because they say, eye is the a window to the body and the soul.
Right.
So you can see everything. So if you come to an eye doctor and you have diabetes, and I detect some changes inside the eye, in all probability there are similar changes in the rest of the organs as well. Okay. So what happens with diabetes is there are multiple stages of it. There's early stage, there is a middle stage, and there is a potentially blinding stage as well.
Right.
So as doctors, what we recommend is you get a regular checkup done. Just the way you get a regular sugar testing done, you also have to get a dilated retinal evaluation done. Because if you can detect the changes early and treat those changes in time, then you are not progressing to the blinding stage. So don't ignore the symptoms. Now, where are all these changes common inside the eye? If you are a long-standing diabetes, 10 years, 20 years, or you are an uncontrolled diabetic, your sugars are not in control, or for a long time. It's not like today you have a sugar spike and tomorrow you are going to have a change inside the eye. It's not that way.
Right.
Long-standing diabetes, uncontrolled. And if you have some other changes inside the body, like you have high BP or you have a high cholesterol, they also contribute to it, right? So whenever we treat the diabetic retinopathy or any diabetes related changes inside the eye, it's not just about the first and most important step is control the diabetes. That's the first and most important thing.
Of course.
An eye doctor can give you treatment, but if you don't control your sugar, it's going to keep coming back.
Very true.
Yeah. And of course, then control the rest of the factors, like control your BP and control the cholesterol. Yeah. So as an eye doctor, yes, please get your eye examinations done.
And control your sugars.
Yes, definitely. First step, first and most important step.
This is also a direct hit to our current cameraman who was just telling me about the French toast he had yesterday. So that was a direct hit. Tanvi, you spoke a lot about how eye care is now becoming accessible to the rural strata, which is such an important point to touch upon. But do you think at some point of time they'll be able to afford better eye care for themselves? Because I think there's such a large gap between how much the urban population can afford in terms of better healthcare. Healthcare in general, not just eye care, as compared to the rural strata. So do you think that there are going to be developments that can make it more accessible to the rural population?
I hope so. I really hope there are developments for that. See, it's a little difficult to answer, but yeah, we hope that the high-tech eye care can be provided to the economically weaker strata of the society. There is a gap, no doubt. I guess it can be a collective effort of, say, charitable organizations and authorities and government who can come up with something. And I think teleophthalmology has a role, definitely. It has already started, it has a role. So let's hope for the best.
Do you think that our local government as well is pushing for strategies to make this better and more accessible?
I'm sure they are. I'm sure they must be in the pipeline. So you'll have to just wait and see.
Right.
Yeah.
I think that would be a very, very important thing for us to sort of close in that division that's currently there, where people in the rural areas can't afford good eye care and healthcare in general.
Definitely.
And really hope that we as a state develop initiatives that can help them. I'm sure we are already. Maybe we don't know it off the top because they're not widely publicized, but it would be nice just to bring that together.
Definitely.
Because it's not like they face any lesser problems than we do. I mean, it's a healthcare problem at the end of the day. It can happen to anyone.
Yes.
So, interesting. I have a loaded gun with bullets on how we can shoot ourselves into better healthcare for our eyes in general. So, could you shoot 5 bullets on how we can maintain better eye care in general? I mean, adults and kids alike.
First and most important, spend some time outdoors. Don't get
Okay.
glued to your screens. I know work from home is it's important in this generation. But yeah, you have to spend some time outdoors, go into the natural sunlight, That's number one. Have a good pair of sunglasses to protect yourself from the UV rays. Third, maintain a good visual discipline. By that I mean is when you're working on a screen, make sure your lighting conditions are good. You don't work on a screen in low light conditions and strain your eyes.
Right.
Then there's something called the famous 20-20-20 rule, which means every 20 minutes, after every 20 minutes of screen time,
Yeah.
look 20 feet away for 20 seconds. It gives that well deserved rest to the eyes. Always if there's dryness, you can always keep a lubrication drop with you which can be used. And eat some eye friendly foods. Inculcate them into your daily diet, which includes something like carrots, green leafy vegetables, and something like pumpkin, sweet potato, and fish. That's like the staple of Goa. So that should not be a problem, right?
My mom ever
Yeah.
watches this, she's going to be, I told you so when it came to, she used to always push carrots on my plate and say it's going to get your eyes healthy, but I never used to. Yeah. Thanks, mom. Sorry, but
Yeah, but say that's what like eye care is all about the basics. So it's
that 20
it's nothing
20
so
20 is such a
complicated.
lovely thing that you mentioned because we recommend it to our clients as well. And you can feel like visibly, you can just feel your muscles like loosen that contraction when you look away. Because I feel like we're so concentrated on a smaller device, like a phone or a laptop, that when you open, it's like a new horizon. Your muscles just relax. They're like, wow, is this the same room I was in for like 20 minutes? It looks different right now.
Exactly, and only 20 seconds can do that.
It's amazing. I think that's a good thing that we touched upon. That's good. Interesting. Are there any other ways that, are there any things that we've been told that do improve our eye health that actually don't work and is just BS?
That improve, like what have you been told?
I mean, for starters, it was from 7 to 8 to look at the sun, which I've now dealt with, or we've dealt with. But
Okay.
apart from that, washing your eyes with hot water.
So washing your eyes regularly.
With
It may
hot
not
water?
be hot water, but wash your eyes regularly
Okay.
with water. Even tap water is fine, but just wash your eyes with water.
When I wake up early in the morning and I wash my eyes, they burn like hell.
What
Why?
water are you using?
They burn with both. Probably because I'm sleep deprived, but
Probably because of that.
this is
Because
my
the water
wellness
should
coach
not-
moment. But I feel in general when I wash it with warm water, it doesn't burn as much as when I wash it with cold water.
I don't think there should be a difference. The
Is
water
it-
cannot cause burning in the
But
eyes.
is there a possibility that because of excessive screen time, when you wash your eyes, it burns?
It doesn't
Is that a
burn.
phenomenon?
No, it doesn't burn. It causes eye strain. There is eye fatigue. There is no burning of eyes. At the most, there will be some dryness, but there is no burning. No.
Okay, so if I wake up in the morning and I wash my eyes and it's burning, it's probably because I'm using.
Probably you've not slept well, you slept late, you've woken up early, your sleep cycle is disturbed. That can cause burning. The water,
Can that lead to, over a period of time, can that lead to any decline in eye health?
not per se, it's not like your vision will go down, but you will have a disturbed sleep cycle.
So just my eyes burn.
Yeah, and you're going to get
It's not
dryness.
harming my eye in any way, the health of my eye. From a
Yeah, it's
longevity
not like your vision is
standpoint.
going to decline because you're not sleeping well. Yeah, but you're not going to have your peace of mind.
Fair. Wise. So, okay, so that's a good routine. I think that's something that we can maintain.
Oh yeah, one more thing.
Oh,
Don't give gadgets to children. That's another
Yes.
thing. It's very common. It's
Parents
very common
watching
that
this, don't give your kids the
yeah,
phone
don't
too
give
early.
don't give it to them so early on in life, you know. It's like to keep the child busy, you show a phone to them or make them watch a movie on an iPad. It's not really required. Let them go out and play.
Yeah.
But don't give them gadgets that early because once you get glued to it, anyways you're going to get glued to it later. So don't do it at the start.
I think all the young kids that are wearing glasses right now simply because they don't have a life outdoors. Their life is, they play games virtually.
Yeah.
That's it. Like we played games, like we used to run out and like get swamped in mud and come back and that was like such a thrill for us. We used to wait for that. Now it's just indoor. Just
Recently I had a
Xbox.
patient who tells me that he plays a lot of football and I was like, wow, that's a great thing, you know. And he's like, no, it's online football. So I'm like, go and play the real football, you know. So that way, yeah.
If there's any goal you're going to score or achieve in your life, it shouldn't be virtual. Unless you're a trader or something, I don't know. But anyways, what's the next chapter in your life looking like from a professional lens?
So I actually aim to, you know, keep a group of like-minded specialists, eye doctors, eye specialists with different subspecialties under one roof. So that if the patient comes, he receives treatment for every problem that he has. That is number one, which I'm trying to. And number two, like we've already discussed, I want the eye care to reach the economically weaker sections.
Lovely.
So I'm trying my part in doing something for that.
Beautiful.
Yeah.
Nice, amazing. If you had to inspire someone that want to take up the same role in the industry that you're in right now, what would you tell them? Or how would you advise them to go about? Because you're credible. Okay, I have like 2 pages on my laptop that show me how credible you are. So if you could
Thank you.
advise someone, how would you advise them? What steps should they take?
See, one thing I can say is there's always a fear of failure. There's always a fear of failure. You're going to have limitations, you're going to feel like you're just not enough. But that should not pull you back, because you have to start somewhere, you know. So I feel you should dream big, be passionate and keep going. There are times when you're going to fall, and there are times when you may not be able to rise, but still get the courage, rise up the next day and then you restart. It's not difficult, but you have to keep going, and one day you'll definitely get there, definitely, and it will be all worth it when you look back. So yeah.
Not to say that I'm saying this in an eye hospital, but that was an eye opener. It really was. But that's all for this episode. Thank you, Tanvi.
Great.
That was very insightful.
Thank you so much.
And guys, if you want to catch up with Tanvi and keep in touch with the work she's doing with her folks at the My Eye Hospital here in Goa, we're going to link her IG in the description below, so you guys can check her out, check out her work, keep in touch. And that's all for this episode. Thank you so much for watching. Thank you, Tanvi.
Thank you, Kelvin. Thank you.
That's a wrap.